From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello everyone, I'm Genaye Channel with my co-host, Dr. Jack Kelly, Interim Chairman for the Department of Emergency Medicine at Einstein Healthcare Network, and this is the ER Show. Today, we are learning about the partnership between the ER team and the EMTs. Dr. Kelly, let's get right to the questions from our viewers.
Sure.
So what is the role of the emergency technician, also known as EMT?
So EMTs and paramedics are the first responders who come out in the ambulance to be able to help us with a 911 emergency. These guys are really the front line for emergency care, and it happens right at the scene. So they might wind up, in your upstairs bedroom, or they might wind up when you had a car crash, or they might wind up right on the sidewalk when you break your leg. And they're the ones that are actually working under our license as an emergency physician and as a medical command physician. I'm immediately available by phone in the ER, and they would call me for further strategy or management or treatment of a patient in the field. They also are able to act on protocols that we emergency physician leaders have already written up for them. So they memorize the protocols to say, okay, a patient with a major allergic reaction, we would give them epinephrine and Benadryl and steroids, and it's already sort of an auto order based on our recommendations. They memorize it, and they're able to act on our behalf for our patients in the field.
So let's just say I'm in the ambulance. What is the communication like between the ER team and the EMT team while I'm in the ambulance?
Well, believe it or not, our communication is getting better and better each year. One of the newest things that a medic will do is if a patient has chest pain, the medic will do your EKG right there at your house or en route, and then hit a button, and then your EKG is automatically sent wirelessly right to me in the ER.
Oh, wow.
And I'm reading your EKG to see whether you have a heart attack or whether I need to activate the heart attack team to come in to help us.
Excellent. Wow. So now I'm at the hospital. The ambulance has arrived. What is it like now between the two teams?
Well, there has to be a handoff, right? I mean, I need to know what they saw and what they were thinking at the scene, what their assessment was, what the vital signs looked like, exactly what was the history and what did the scene look like, and then what did they think was going on, and then finally, what emergency therapy did they render, and then what was the patient's response? Did they get better? Are they getting worse? So there's a really quick handoff between us, usually right at the door, where I'll quickly take a look at the patient, feel their pulse, and then while looking at the patient, hear what the medics were telling me, and then we'll get the patient to bed, begin emergency therapy. Oftentimes the medics will stick around and spend the next 15 minutes with us as we begin to gather more insight, and then we try to teach the medics what we're thinking too. So we make them smarter and smarter because they are our eyes and ears and hands in the field.
So just in case of an emergency, what can you tell patients out there to expect from a team, of an EMT team?
Well, the medics are literally part of our healthcare safety net, and the paramedics literally are there to be able to be almost like a fireman who comes if you smell smoke, or a policeman if you think that there's need for police. But the medics are sort of like that medical safety net, and then they transfer all of what they did right to the ER, which is the big safety net for healthcare.
Well, Dr. Kelly, thank you so much for your time and sharing great information about EMT and the ER team.
Great.
Make sure you watch more episodes on this topic and other issues of interest to all patients here on the ER Show. We will see you next time.